I'm online, but I can't log on with my face because we've muted everyone. And she just wanted to say hello and nice to see you.
Hi, Rose.
Rose.
Oh, technology is great until it causes us challenges, and then we're, but I'm glad we're able to work through this. So,
right. And Rose is on the board for the Reading, North Reading Chamber, Dr. Spardelli.
Oh, okay.
Which is great.
Good to know.
Yeah, she's wonderful, as is Judy. We've had a lot of fun planning this.
Yeah, that's great.
Yeah, we have had fun. I'm very grateful to you, Lisa. So.
Oh, I appreciate your help. So just because it's just exactly 6 o'clock here, maybe we'll wait a couple moments and allow a few more people to log on. Really appreciate everyone joining us during the dinner hour. Such great news to get updates on what's happening with Melrose Wakefield and all the vaccines that are coming our way. Perfect. Let's see. So I understand tomorrow's going to be warmer, which will be a treat. I thought my house was going to blow down like a...
Oh, the wind was incredible last night.
It really was.
Absolutely incredible.
Absolutely.
I actually did that. I actually called my husband a little while ago and said, I just want to make sure we have power when we come home, when I get home.
Yes, it's very important to have heat these days. It got quite cold, but I think it's going to be in the mid-40s tomorrow, so that'll feel great.
My daughter went down to Costa Rica and it's 103 degrees.
Oh, she's probably worried about getting sunburned.
Yeah, exactly.
This time, wow. Wow.
Yeah, 103. Can you imagine? Oof.
No, thank you. No, thank you.
Definite change of climate. I'm sure it feels great for the first couple days, but after that, it probably get a little warm.
A little warm, a little sweaty.
Yeah, absolutely.
I hope she's at the beach.
She is.
And not in the jungle.
No, this time she's going down to take Spanish. And
oh, awesome.
So.
Awesome.
That sounds like a great trip. So I think I'll just give it one more minute and then I'll officially kick us off.
Okay. And you'll hit record. You'll let people know before we hit record.
Yes.
Okay.
That's a good way to do it. Let me just, I can do it on my end.
And then if you need to get the hook, Judy, just let me know.
That's what I said. I said, Lisa, I'm going to let you take care of that with Dr. Spardella if we're running late.
No problem. Okay, well, why don't I officially kick us off? My name is Lisa Egan, and I'm the director of the Reading, North Reading Chamber of Commerce. I really appreciate everyone taking time out of their evening schedules to join us for an important update on what's happening with the COVID-19 vaccinations. I did want to mention that this event is being recorded. We're going to be sharing it with both Reading and North Reading Public Television so people can learn from Dr. Sardella's expertise, as well as refer back to it for people who want to learn more who weren't able to join us tonight. So just know that. And if you could kindly keep yourself muted, just as a housekeeping point, I'll turn it over shortly to the doctor who will share some updates for us. And then if you have questions that might arise, I ask you to post them into the chat. The presentation should last for about 20 minutes, and we'll have time for questions at the end. And we also have some resources to share. So if you have more specific questions or things that we can't cover, we'll absolutely make sure that we get your follow-ups taken care of. So first, I'd love to introduce Judy Sadaka from Melrose Wakefield Healthcare. We've worked together for many years, and she is the Physicians Outreach and Community Relations Manager for the hospital. And I really appreciate your taking the time out of your very busy schedule to tell the community what's happening on this important health topic.
Thanks, Lisa. I really appreciate all of your help in arranging for this evening's program. And before we started, I just wanted to take a moment to thank the Reading and North Reading communities and the Chamber of Commerce for their continued support of the hospitals and all of our staff over the past year. We really wanted to say that we appreciate all the masks that were sewn, all of the kindnesses that were shown, the treats that were dropped off, the chalk drawings, the kind words of thanks and encouragement, the surprises that were left for our staff, as well as the wonderful parade and continued support that you have all shown. It has really been overwhelming, and we really thank you. As trying as the past year has been, we're all very grateful to you, because knowing that you have the support of the communities where you live and work, I think that makes the difference to each one of us every day when we come in. So I just wanted to take a moment and to say thank you to everyone for joining us this evening and for everything that you've done for over the past year. So thanks, Lisa.
Sure, of course. And thanks also for putting together this wellness series for us. Just briefly, I think everyone who's seen anything in the newspaper knows how important health and wellness and mental health is. So we have a couple other programs that are coming up with experts from Melrose Wakefield Healthcare, including an online cooking demonstration by registered dietitians, which is on Wednesday, March 10th. And a sort of 10-minute mini exercise sessions to incorporate into your routine on Tuesday, March 23rd. These are all free thanks to the hospital, and we're excited to share that and happy to share that information if anyone would like to join on those other community events. So without further ado, I would love to introduce our speaker, Dr. Steven Spardella. He is the Chief Medical Officer of Melrose Wakefield Healthcare. He has 30 years of leadership experience in emergency medicine, including 12 years as the chairman at Melrose Wakefield Healthcare. And during those years, Dr. Spardella completed a fellowship at the advisory board at Washington, D.C. He received his undergraduate degree in philosophy from University of Vermont and his medical degree from the University of Rome in Italy. Now, I would love to hear about your degree in studying abroad in Italy. However, that is not our topic for tonight, but perhaps another time. But thank you again, Dr. Spardella, for joining us tonight, and I will turn it over to you to share some updates on what's happening with the COVID vaccine.
Great, thank you, Lisa, and thank you all for giving us the opportunity to talk about the vaccine. We take every opportunity possible to help people understand how they function and what's out there, and also to try to get more of an ease about whether to receive it or not, because we do acknowledge that there are some people who are a little skeptical about this. So to try to put this all in 20 minutes, I won't move quickly, I'm just gonna really hit the basics about things. First of all, we've been vaccinating people now for, since the beginning of December. And I've received the vaccine. I've received my second shot and really had no ill effects from it. But vaccines in general, and so they're really important. The reason why vaccines are made available to us is to really help us develop some immunity against illnesses that pop up, and we're all in the pandemic. Think of it this way: if your body something is introduced into it for the first time, your immune system is basically learning on the job. Doesn't know about what it is. It's trying to learn and trying to develop on how to neutralize whatever it's coming to its body to make your body, to protect you and to make you feel better. What vaccines do is it's sort of the priming of the pump. Their service is to teach your immune system about what it might get exposed to. So when and if and when you get exposed to something, the proteins, the immune system has already been geared up, and it will attach and be much more efficient at protecting you and neutralizing whatever you've been exposed to. That's the importance of a vaccine. It really is to teach your immune system and prepare your immune system to become exposed to whatever is out there, whether it's the flu vaccine, measles, mumps, rubella, HPV. They're all meant to do the same thing, to teach your body. The vaccines that are out there right now, we hear a lot of press about how they're new, they've been rushed and so forth. The technology that is being used for the vaccines that are being developed now has been around for a little while. Actually, in the technology that makes the vaccines like Moderna or Pfizer use has been around for a while, especially around developing medicines that will fight off cancers. First time it's really been used in a vaccine process. And it sounds like it's been going quickly, but really the steps that you normally would take in a virus and licensing a virus are done in series. What was different with the production of these viruses is that things were done in parallel. So you took this long extended process and really kind of overlapped a number of steps, allowing for the release of the vaccine under emergency use authorization. Now, what that means, and this is all about this, trying to let you know the technology and the manufacturing, the safety. What emergency use authorization really means when you hear that term is really the scientists at the FDA and the CDC, and if you believe in the scientists at the FDA and CDC, it's really important. For us, it's our source of truth. They really outweigh the benefit of the vaccine as opposed to the risk of not receiving the vaccine and the risk of developing an infection from the coronavirus, COVID-19. So what has been made available? So it's really been, the technology has been in place for a while. It's just the speed and to some degree the politicization of the process has really made some people, I think, skeptical. But in terms of the science of it, it is a safe vaccine, both the Moderna, Pfizer, and the Johnson & Johnson, which we have right now. Really kind of interesting how they function. They're really made to sort of fool the body. If you think of a spool of thread as what a virus looks like, the Pfizer and Moderna viruses, if you take a little piece of that thread, inject it into someone's body, then that becomes the schedule, the menu for your body to make the proteins to fight off any infection. So it basically is made to create a situation where your body becomes the manufacturer of the vaccine. Vaccines are essentially little groups of proteins. They're chemicals. They look like this. And antibodies are made against this that look like a sort of a scoop that go over it like this. What the mRNA viruses do is the lab has created something in a chemical. It's not the virus itself. You can't get sick. It's not just a little piece of mimicking a little piece of the virus that would create the structure of the virus, the coronavirus, that the scientists feel this is the important one. This is the one that makes it stick to your body and can cause the infection. So you get the mRNA, inject it into your body, chemical goes into your cells, and your cells stop making proteins, antibodies against the proteins that are made to mimic this structure, this little spike. And that technology has been around for a while, and that's where the Pfizer and Moderna virus came from. The downside of both those vaccines, the Pfizer and Moderna vaccine, the downside of both those is they're very volatile. They're very labile. They're not very stable. So they have to be protected. That's where a lot of the keep it at -80 degrees Fahrenheit for a while. That's now changing. How you mix it very gently. You can't move it because that little piece of thread, that little piece of RNA is by itself incredibly fragile until it gets into your cells. That's some of the difficulty in trying to set up vaccination sites. As they change and modify the fragility of it, which I think it was last week that the FDA said, now we don't have the way it's being processed now, we do not have to keep it at -80 degrees Fahrenheit. So those are two of the vaccines we have. The latest vaccine that has come out, you heard about, is Johnson & Johnson. It's a little bit different. It's a little different technology. It actually takes a virus that we are in contact with all the time. It's called the adenovirus. It's the virus that causes a common cold. And what the scientists, what the lab personnel can do to that, it can inactivate that virus. So it cannot infect you. But it acts like a Trojan horse. Inside that virus, they put the DNA of the coronavirus in there and actually earmark it for the little piece of DNA that makes will make the mRNA, which will make the protein, which will make your antibody. So it's, again, it's a little more stable because it's protected, but think of it like a Trojan horse. It's introduced into your body. It releases the chemical it needs to release in order to stimulate your body to make the vaccine. So essentially, with all these vaccines that we're using to date, they're safe because they are pieces of the virus, chemically mirrored pieces of the virus that are thought to be the most important piece of the virus and how it infects people. Gets injected into your body. Your body then makes everything it needs to fight this off. You've heard about things about effectiveness and what's the most effective and what's not. As a rule of thumb, you should know that the flu vaccine, which a number of us get every year, if it's thought that if it's 50% effective, that is really good. So you've heard the numbers of probably on the news. Pfizer is 95%, Moderna is 94%, and then Johnson & Johnson is between 67 and 70% effective. All of which are good. All of which are good. The scientists, and we listen a lot to the CDC, feel that whichever vaccine you have, based on those numbers, it is very protective to your body. Does it matter if you get the Pfizer or the Johnson & Johnson? At some point, it doesn't, because if enough people are vaccinated, it's just a numbers game. It's all numbers. If enough people are vaccinated, then you have what's called herd immunity, which means the chance of you coming in contact, chance of you being in front of someone who has not been vaccinated is a lot less. So that rule of thumb is when 70 to 75% of the population has been vaccinated, then the chance of you coming across someone who has not been vaccinated is so much less. That's herd immunity. So just knowing those three numbers, 72, 67 to 72, 94, 95, it all gives you a lot of protection. And I don't know any vaccine site in our area that says people can choose whichever they want. It's whatever is available at the time is what you will be offered. Right? Currently at our hospital, we have both the Moderna and the Pfizer vaccine. We've applied for Johnson & Johnson within our system, which is Tufts Medical Center, Lowell, which is Circle Health, and us. Just this week, Lowell and Tufts have been earmarked to be allocated Johnson & Johnson. Right? So it really is what we all have available to us is what is really based on the supply that the state receives from the supply that the federal government has available. And then it's allocated. And the allocation really is based on how much you use. If you can use up what you were given in 10 days, you'll get more. So there is a process. The timing about all these is very important. So if you think of the Moderna vaccine and the Pfizer vaccine as the ones you need to have 2 shots, the first one is priming the pump. The second one is the booster. The thing about vaccines or even infections or things you might be allergic to, every successive time you come in contact with whatever you're fighting off, you have the chance of having a much more robust reaction. So when you get the first shot, which primes you, your body is building up immunity and learning what it should respond to. And you get the second shot, which is, again, making your body make those little pieces of, mimicking the little pieces of virus that are important for it to cause infection. All of a sudden, it knows what to do. It makes a much greater response. And really, so it really boosts your immune system to prepare it to protect you from getting infected or to neutralize the virus. A few questions that have come up over and over and over around vaccine is, are the side effects really bad? Am I going to get side effects? Every person is individual. You know, 60 to 70% of people who receive the second shot of Moderna or Pfizer will get something. That's the rule of thumb. Something from mild headache, aches, you get nauseous. Some people can get really achy, sweaty, or fever, but those go away. That's your immune system, the inflammatory reaction for your immune system really kind of taking charge. Those symptoms go away in 2 or 3 days. They almost like fall off the cliff. They almost like go right away. And you could treat those by staying hydrating, ibuprofen, Tylenol. But we tell people, expect to get them. If you don't get them, fantastic. But wait it out. And this is what you should expect. If you go into it knowing what to expect, it does prep your body on how maybe you might react to it. The beauty about the Johnson & Johnson is one shot. And it's just a different chemical structure and so forth in one shot. The allocation of that most likely will be given to areas where equity is an issue. Getting that vaccine to places where people don't have a lot of the full access to get to healthcare, and you have to go to clinics and bring the vaccine to them. It just makes it easier. So you try to use the simplest process with the most difficult patients to get to. So we think the Johnson & Johnson most likely will be allocated to more urban areas, until it's open up to the general public. And what's new on the horizon is really modifications of these. The question, what's new on the horizon, or actually, let me take that back. What's unknown on the horizon is how do these vaccines react to all the variants that you hear about, whether they're all being named by birds now because there's so many of them. We have about 11 of them in America right now, but the big ones you hear are South Africa and UK and Brazil. The current thinking, and we use that word a lot, the current thinking, because again, this is all relatively new in the world of science. The current thinking is that you still do have protection. Do you have as much protection? No, but you have protection. And think of it this way: if this is the protein on the virus that you would react to, normally your antibody would come in and surround it and neutralize it. What a variant is something pops up. There's a change in the structure of the virus. So when the antibody comes up, it doesn't fit as tightly over the virus, but it still offers protection. So does that mean the vaccines aren't going to change in the future? Absolutely not. Most likely, all the vaccines in the future will be tweaked a little bit, just like the flu vaccine is every year, based on the current variants that are available at that time. So no one knows if you'll need a booster in the fall. No one knows the long-term effects, because long-term, it's only been a year, less than a year. No one knows all the side effects that will happen. We only know what has already happened. And we don't know if there will be new vaccines coming out. There are over 100 vaccines being tested around the world, and we will get to know little by little by little. Some of the questions that also have come up is children. What are the age groups? So the Johnson & Johnson goes no lower than 18, Pfizer no lower than 16, and Moderna 18. There are studies right now that are looking at studying children from age 12 to age 18. We think in the fall there will be another study from age 6 to age 12. And eventually, after that, infants to age 6. And those will come with time. Just like our vaccines in the past, those will come with time. Another question that comes up is around pregnancy, if you get pregnancy. If you're thinking of getting pregnant. There aren't any long-term studies that have looked at the vaccines and their safety profile in terms of pregnant people who want to get pregnant or who are pregnant. But there are 4,000 women right now who are pregnant who are in a study with Pfizer and Moderna. If you look at the scientific colleges, the American College of Obstetricians and Gynecologists, they recommend that if you have the option to get a vaccine, you should get it, because there's a greater risk and have an ill effect on a pregnancy if you have COVID as opposed to get the vaccine. It's a balancing act. It's a risk-benefit issue. That's sort of in a nutshell of where we are. We are in a process right now where we are being directed by the state of Massachusetts who can and who should not be vaccinated right now. Those will change. Actually, as of well, we're in a situation right now where we can vaccinate anyone who's 64 years old or older, or 18 years or older who have two illnesses. I understand the president today is expecting to have enough vaccine to vaccinate everyone by the end of May. You won't get vaccinated by the end of May, but the vaccine supply will be there. And we will open up in our side. I can only speak for us. We will open up according to what the state allows us to do. And really, the state, the DPH, is dictating the allocation of who gets what vaccine and how you use it. And we attest that we will use it based on the state's mandate to us. So, in a nutshell, their vaccines are made in laboratories right now. They are not viruses. You can't get the illness from the vaccines that are available right now. You'll get the inflammatory reaction that your body needs to make to develop the immunity against getting ill. Does vaccine protect you? Yes, to some degree. Do you still have to wear a mask and still practice social distancing and wash your hands often and not touch your face? Yes. Because, like, I've been vaccinated, I could be out in the public. I could have been exposed to the virus. It could live inside my nose or my eyebrows. I could sneeze and pass it on to someone else. Plus, until we have herd immunity, you don't know if the people you are coming in contact with have been vaccinated. So, but as more and more people get vaccinated, you'll see those rules change little by little by little. It is truly a numbers game. So, are there any questions? I know that's a lot of information in a very superficial way of describing it, but my intent is to explain how it's made in a very practical way, and it's safe, you can't get sick from it. We actually strongly recommend it because it teaches your body how to react to coronavirus and the illness of coronas. And the coronavirus that's out there now can hit any age group. Most people are probably asymptomatic, but people who get sick, you just don't know how sick you're going to get until you're in the midst of it. So, any questions? I'm sure there was some.
A couple of questions did come through on the chat and also on my phone. One question was, do we know how long people are protected once they get vaccinated?
No. So we only know. So vaccines really from phase 3, which were back in June and July of 2020. The people who are in those phases, the way they're determining if they have an effective amount of antibodies and effective immunity distances every month, they're still in the studies. They're having antibody titers drawn, blood tests drawn every single month to see how far out they still have antibodies, and are those antibodies effective? Okay, right now there's a comfort level that says at least 3 months. The expectation is absolutely a lot longer than that, but until the scientists are done studying those different timeline, we do not know. So that's why in our world we're asked a lot, am I going to have to get a booster in the summer or the fall? We don't know. We will be told that. But the people who are in the phase 3 study are still in those studies, and that's what they're looking for. So the exact answer is we don't know.
That's fair. I know that there's still so many things evolving, but it's good to know that the vaccines are available and more are becoming available.
Yes.
And that, based on what you're sharing, it sounds like no matter what is offered, take it. It's worth absolutely going for Johnson & Johnson versus waiting and wondering when another one may be available. A bunch of questions have just come in. So one person asked, is having a pacemaker for a high heart rate and asthma considered two of the illnesses that would prompt you to get the vaccine? I don't know if that's too specific. No?
That's pretty specific, but moderate to severe asthma is one of them. There are 12 chronic conditions that are listed by the state for us to consider to count as those two, we call them comorbidities, they're illnesses. Having a pacemaker in our fast heart is not one of them.
Okay.
Now, if the reason why you have that Might be something else, but might be. But just that alone, just knowing that, and the asthma, not itself, and even asthma itself, it's moderate to severe asthma is one of the chronic conditions.
Thank you. Another question. Once you are vaccinated, how long before you reach an acceptable level of protection?
About 2 weeks after this, about 2 weeks after the second shot for Moderna and Pfizer, and around 28 days after the Johnson & Johnson. So yeah, so you're in the, right now where we are, you're in the Moderna Pfizer world. 2 weeks after the second shot is when you have the peak efficiency. You've arrived at that point. If you only get one shot, you're at about 40%, 50%.
Gotcha.
So
I'm trying to read these at the same time. Someone asked, until more of the public are have the opportunity to get vaccinated, what are your thoughts on double masking?
I have two schools of thought. Should do it or should not do it. What the double masking, the idea about double masking is really made, masking in general is meant to protect you from being a source of an infection, also to protect you from receiving it. So in that, the important thing about a mask is how tightly it fits or how snug it fits against your face. Most masks, especially the blue ones, if they hook over your ears, right about here, is they bulge out a little bit. They kind of, like little bird's tail, come out and bulge out. If you fold that in so it's against your skin, that's sufficient. And
Okay.
tighten it across your nose, that's sufficient. And actually the mask you use is important. It should be multi-layered. A real kind of a real practical way to see if your mask is of any benefit is get your phone and put the flashlight on, put the flashlight in the mask. If you can see the fibers of the mask, individual fibers, it's not good enough for you. If you take one of those blue, yellow masks you can buy anywhere or get somewhere, do that, you'll see the light will be looking like you're looking at the moon through thin cloud layers. You know, it'll dissipate it a little bit. So it's more about the fit. What two masks do is the second mask just helps to press the inner mask a little bit against your skin. It really is, if you have a mask that is over your nose that you can kind of clip and come down and come over and come down, so there's not airspace that's available. Again, not snug, so it's going to like crush you, but not snug airspace. That's when it really not as efficient, because again, the virus is aerosolized. It goes through the air. It's going to go for the track of least resistance, coming around you either over the top or through the sides. So again, if you could just take your mask, and another way to get that to work is instead of having your mask come over completely over your ears, right where the mask ends, the blue piece, right where the mask ends, right here, tie it into a little knot. So that automatically folds the inside. So when you put it on your face, it's tight against your cheeks. Let's try that. You can actually Google that and YouTube that, how to make a procedural mask tight, and that's the best thing. So two masks, if you feel the first one is loose, is okay. One mask is really needed if it's snug against your skin.
That's great. The tips on the masks were very helpful. I never really appreciated the tightness of it, and the tip on how to check to see, how thick it is. So we have time for one more question, then we'll wrap up because we're a little after 6:30. Someone asked if caregivers for the elderly are not able to be vaccinated yet, but your mom, and they're taking care of an elderly parent. Is it okay for you to care for your parent without having had the vaccine yourself?
Yes, as long as you are masked. So again, if you think of anyone you come across could potentially be an asymptomatic carrier of COVID. Think of that, because a lot of people are asymptomatic. You could be also. As long as you wear a mask, you should be able to go in and care for your elderly relative. Again, just that should be going on anyway. And even when you're vaccinated, you should also. Remember the thing about vaccines, when they say 95% efficient, that means 5% aren't. And you won't know who those 5% are until someone gets sick, even if they've been vaccinated. You know, so you still have to protect someone. So if you go into care for an elderly family member or a neighbor, then wear a mask, you know, as best you can, social distance, wash your hands, wash your hands, wash your hands, but wear a mask and make sure you change the mask every time you go in there.
Perfect. Well, this was great advice, and I know I learned a lot just from hearing about how it was all made and the visual illustrations with the virus and the thread, and I really appreciate your taking the time. I imagine that you're very, very, very busy managing the vaccine program for the hospital, so it was very kind of you to take some time to share that with our community, and thanks for all the outreach you guys have done as well.
You're welcome. Absolutely our pleasure, and we'll answer all your questions. You'll pass them through Judy. We'll get back to all of you. If you ever want to do this again, we're more than willing to do it. So, but and again, thank you for the opportunity, because we look at every opportunity to go out and preach what we want to preach. So.
Oh, it's excellent. And I did put in the chat a website where people can get the most updated, scientifically based information, as well as a community email that people can use to ask additional questions or things that might come up. I also want to take a minute and thank representatives from Senator Jason Lewis's office, as well as Rep. Jones and Haggerty. I see that we have guests from their offices as well. So I really appreciate everyone taking the time to come, as well as our public television stations for covering this event so we can share it and other people can learn from your expertise. Thanks again to Judy for planning this with me, and looking forward to the online cooking class, which will be just as informative. Yes, absolutely. So thanks again for your expertise and for sharing it with our group. And thanks so much for the event to Melrose Wakefield Healthcare. Much appreciated.
And thank you, Judy. Thank you. Have a good night, everyone.
You're welcome. Thanks, everyone.